Understanding metastatic breast cancer, MBC. Metastatic breast cancer, or MBC, is cancer that has spread outside the breast to another part of the body, such as the liver, brain, bones, or lungs. While MBC is currently incurable, there are treatments available to delay progression or worsening of the cancer and prolong survival. For many people living with MBC, understanding the complicated science of their disease and treatment options becomes a necessary part of the journey. The role of estrogen in breast cancer. Treatment approaches depend on the type of breast cancer, which is often categorized based on the hormones at play, estrogen and progesterone. These hormone receptor cancers can be categorized as hormone receptor positive, HR positive, and hormone receptor negative, HR negative. Within HR positive cancers, there are categories that emerge based on the hormone estrogen receptor positive, ER positive, and/or progesterone receptor positive, PR positive. Estrogen is a hormone that circulates through the body. Both women and men produce estrogen, though at different levels. As estrogen moves through the body, it passes directly into healthy cells that have special receptors. Estrogen works by binding to these receptors, which serve as parking spots for the hormone. When estrogen binds to an estrogen receptor in a healthy cell, it plays an important role in normal functions, like managing mood and reproduction. However, there are some cancers that use estrogen to grow. About 3 out of 4 of all breast cancer cases are ER positive. In these cancers, estrogen acts like a fuel, triggering and contributing to the cancer's growth. Science has shown that if you can block the use of estrogen by these cancer cells, you can better control the cancer's growth. Unmet needs in ER-positive MBC. There is currently no cure for MBC. That's because, like many cells in the body, cancer cells adapt to their environment. They can mutate to make treatments less effective, leading to drug resistance and disease progression over time. This commonly occurs in ER-positive MBC. While hormone therapies are often effective early in the course of disease, long-term treatment becomes a challenge. When cancer cells become resistant to therapy and progress, patients may have to use multiple treatment approaches over time. A potential approach for ER-positive MBC investigates damaging or degrading the estrogen receptors. Imagine the estrogen receptor is a parking spot in the cancer cell. Estrogen, moving through the body, is drawn to the parking spot. A potential approach involves stealing or blocking the spot, so the estrogen has nowhere to park. Without estrogen parked on the cancer cell, the tumor cell cannot use the estrogen to grow. Then, the receptor is damaged, so it also can't be used in the future. Sanofi's commitment to patients with ER-positive MBC. Through ongoing research, Sanofi scientists and others in the industry are working to respond to the unique needs of the MBC community. Visit sanofi.com to learn more.